Testosterone for women. This is a video that I needed to make as it's relevant in the world because more people are taking testosterone, of course, androgens, not just young people, but old people, because this really is going to be focused for women that are perimenopausal and postmenopausal testosterone. So let's get right into it, okay? This is going to be evidence-based, and I did a lot of research for this because I'm speaking next week at Steve Kucklow's Upgraded Human Mastermind event in Dallas, Texas, and I want you guys to come out and see me. I'll be talking on modern androgen therapy appropriately. Of course, I involved information with women that's up to date and really evidence-based. I'm also going to have a booth because Steve has a bodybuilding show there. So come by and see me, please, next week. Okay, here we go. So benefits versus risks for women. You could see there's the wink face because she's thinking about the potential. Then we go into just the flat face. And then we go into the sad face with the side effects. So let's go here. Who is going to be looking for testosterone if you're a woman? Again, beyond the PEDs. I'm not talking about the performance enhancement use, which I know a lot about and I've learned so much about. Thank you, amazing women in the world that have trusted me with consultations over the last 20 years from the levels of bodybuilding, powerlifting, strong man, strong women, and just regular women that are using androgens as PEDs. We see this, okay, and the data is growing and growing and growing. But this is really evidence-based for women that are using it. And who those women are going to be? It's really going to be menopause or perimenopausal, and that's women in their 40s to 50s, general class. What are the symptoms? What are the symptomology of these women that are doing this? It's the same as men. Malaise and fatigue. I lost my energy. My body's changing. I'm changing my body. I'm getting more fat in areas, and my arms are not as tight as they be, doctor. What's happening? Testosterone's great for men. Is it for me? And the last thing here, sex. No question. For men and for women, the sexual complaint and the effects of androgens on the sexual symptom, libido, and there's no erectile dysfunction for women, but we're going to talk about the clitoral changes and all the sexual, because I've really been involved in this, for many, many years, and it's time for me to get out and make a video for you ladies out there. So the sex, there's a condition called hypoactive sexual desire disorder, which is a legitimate clinical, real symptomology for women that have low sex drive and they're having problems with sex. And again, this is not just peri or postmenopausal, this is actually just adult women. So that's complicated right there. But this is more for women that are really, again, perimenopausal, 40s and 50s and beyond, suffering with all these things, but mainly the sex, in my opinion. Now, the diagnostic aspects, if you look at what's going on clinically from the traditional medical community, that I'm with them, okay, I'm more with them than I'm not with them. But it's interesting that the Mayo Clinic, you could look here and see that they're very careful with it. They do reference that it's relevant for women, that women go through menopause and perimenopause, and that androgens may help, big functional word may. And of course, they go into the estrogens and progestins we're going to talk about here, very complex. This is much more complex than it is for women than men. That's why I've stayed away from it. It's just too complex. And we don't know. It's irritating for you women, is it? We don't know. We're not sure. We need to study it. Oh my God. I agree with you guys. It's you women. It's tough. What are you doing? So no wonder that the anti-aging, the wellness in these clinics have just exploded, not just for men, but for women, because they need to fill a vacuum. They're giving something. They need to help in the absence of data. The FDA, it's off-label. Doctors can give it because we can give things off-label if it's going to help them. Just need to be appropriate with risk assessment, and you need to monitor people closely. But we use things off-label all the time. Doctors, thank God, still allowed to do it. It's got to be case by case, and you have to watch someone very, very carefully. Okay, now, when you look at what's going on in these clinics, Again, they're doing lab evaluations. There's no gynecologist involved, though. Typically, the traditional medical community is really kind of been diametric. It's been opposed to this. They're coming together because they have to now. But still, the primary care, the OB-GYN, the traditional family medicine, they're not getting involved in this, and they need to. Because I'm an internist, I'm a standard doctor, I'm a regular traditional physician, but I've become the anabolic doc for men. So, and now I'm opening up, obviously, and I'm interested in what's happening to women as well. But I don't treat women because I've never felt comfortable, kind of like the traditional guys. Okay, now, benefits. What are the benefits of testosterone for women? Number one is going to be sex. And we're going to talk about the real libido and the physical. When you think about libido and erectile dysfunction for men, for me, I think about the libido and then I think about the clitoral, what happens to the clitoris. Again, this is we've known this historically, anecdotally from women that have used androgens for decades. Okay, so the mood, the energy, the confidence, the body habits changes. I mean, it really changes for women. We've known that with a pad, dose dependently. The more you take, the more combinations, you see these incredible body changes because the muscle responds to androgens with the skeletal muscle. Now, I put over here osteoporosis, question mark, because I did a lot of research for this, and I was like, I wonder if there's benefits of testosterone as it is for men, older men that are older and they have medical issues, maybe on corticosteroids historically, maybe they're frail, cachectic, using, for AIDS patients and things we see, using androgens and anabolic steroids for the muscles and the bones is beneficial, but there's a lack of data for women. I want to be very careful with you guys. Everything here is evidence-based. There's no evidence for it. I'm going to say it's questionable, osteoporosis. But body habitus, where the body changes, no question. The confidence. I've asked women, just for this video, confidentially, I've asked them, so you're on testosterone. Tell me real quick, what was the number one thing? Sex, number one, unbelievable. Hands down, unbelievable. The risks we'll talk about next. But what else? I said, what else? And they said, confidence. Just confidence, just well-being, and just uplifted and just poppy and bouncy. I couldn't believe it. Of course, in the body, right? Looking forward to the gym, getting pumped. These women tell me they're not pro-bodybuilders. They're on testosterone, not even that much, and they're getting better pumps. Unbelievable. So let's get out of the benefits. Let's talk about the delivery system now. So how do you get it? What is it, testosterone? So we got pellets, we got gels and creams. There's no oral. Very interesting. Oral we have for men, testosterone undecanate, 2 formulations in America. Okay, trade names. And we have that for men, not for women. Oh, I researched this deep. And then, of course, we have the injections, microdosing. Now, here's the amazing piece when you look at delivery system, why it's so potentially dangerous. I'll go into it in the end, but it starts off on delivery system here. When you think about the dangers, when you think about the hormones, for men, we're just giving androgens and we're blocking with estrogens, estrogen blockers. And I don't want to hear about the few guys that are taking testosterone with estrogen. That's going to be something very, very minimal and kind of very, very, very off the scale. But for women, depending on your status of if you have a uterus or not, they give, this is going to be creams and gels mainly, if not exclusively, estrogen and progesterone. Again, I've read this and I've known this for years, and the reason why it's so complicated, because depending on your status of having a uterus or not to mention other status, with your sex specificity, with the organ potential for cancers, it's unbelievable. So injections, testosterone, creams and gels, pellets. A lot of places go for pellets. I'm going to just run here quick for you ladies. I don't like them. There's no time release mechanism. It goes like for men, just as for men, way up, maybe too fast, and down. You're putting the pellets in. It's a procedure, and there's so much time in between, and they're just sitting in your body. Some of them extrude out, actually. It's rare, but it's just one of the side effects. And it's just not optimal the way it goes up and down. But again, You might want them and they may work for you. It's not it's not against them personally. My life is, I'm a testosteronologist. I've been living, sleeping, eating, and breathing this stuff, pooping too, for 30 something years as a doctor. And I've been on this stuff myself. Pellets, I don't like them. Gels and creams, interesting. You're going to just put a combination of gels and creams with estrogen, progesterone, and you're going to put in also testosterone. I just don't know. This is why I'm tapped out. I don't do this. It's too complicated. So injections, in my opinion, microdosing, little teeny baby injections like Cypionate or Nanthate, maybe Sustanon 250, that's going to be what women are going to do. Tiny, what are the doses? About 10% of what you do with men, more or less. Dose dependent, side effect profiles are key, okay? You want to get that dose as low as you can, to move it, feel good, and then monitor. Now, here we go, risks. Let's go into the risks, ladies. Here are the risks. Sex-specific cancer stuff first, right here. That's why we get up here. I have the arrows to the estrogen plus or minus progestins. Now, you have a history of breast cancer, ovarian, uterine, endometrial cancer, cervical cancer. It's really serious. It's very serious. This is why I don't like that these clinics, the anti-aging clinics, really are working apart from gynecology, not to mention internal medicine. I don't like that. We got to come together on this. Again, your doctor is going to frown on this stuff, and you love your doctor, your gynecologist, but what do you do? I mean, and people, just like men, women now, they're going to the clinics and they're hiding it from the doctor. And you can't do that. Can't do that. So again, number one is this, and I don't know the data for this. I've looked at it again for this presentation. I was like, it's real, it's there, and it needs to be talked about. So that's going to be number one. Okay, those are what we call the frank contraindications. You can't take it. I mean, you just can't. You can't take it. So next, when you and the clitoris. So it's very interesting. So very, very, very interesting. Men, when they go through puberty, their secondary sex characteristics change with the voice and the hair, and women go through some of that. As far as the voice will change, the side effect. It's again, as far as the side effect, dose dependent, drug dependent, how long, what's going on, is it sexy, is it raspy, is it not? This is interesting. The clitoris is going to change too. And again, a lot of women don't know that, but I've talked to women about that, and we all know this in the industry, that that's something that for most women is a positive thing because it makes the sex better. Very interesting. Let's get some comments on that. If some women would please make some comments on that. And no joking comments. This is going to be an appropriate discussion here. No funny stuff, guys. Okay, so when we look at the breast stuff, what do we have next for the side effects? And I talked about the clitoris, obviously. So we have the hair and the skin. So you're going to lose hair, male pattern balding, which is tough, right? Not just for men, but for women. And you're going to put hair in places maybe you don't like it. And that's going to be real, okay? Not to mention other parts of the body. Skin, acne could be a game changer. Not to mention with the other hormones. CNS, the mood, the anxiety, the aggression. Again, there's no difference with these side effects, men versus women. I wanted to get the sex-specific stuff out of the way first, as I just did. Next. It's funny that I have breast because I go head to toe for men, so I did it here again. Breast changes. You're going to lose the breast tissue. If it's a younger woman, even a middle-aged woman who's just going through perimenopause or menopause, and if she's never had an augmentation or anything, which women haven't, if they haven't, you're gonna lose. You put muscle on and you lose fat, and the breast is made of fat. You see? This is incredible. I never knew this stuff until I got into this world of all these peds with androgens of women. I didn't realize that. Men get gynecomastia and bitch tits. Women lose their breasts. Wow. It's so paradoxic, this stuff, when you really think about it. Now, this is kind of a joke for me down here, LOL stuff, but it's very serious. With men, we give anti-estrogens. With women, we're going to give estrogens. I know some men are taking estrogens with testosterone. That's beyond the scope of today, and that's super rare, and I don't know where that's going to end up. I don't know. So, and that's not really happening. That's really not happening. So, thank God. So, We're blocking estrogens for gyno, for the brain, for my puffiness, for my mood, for my sex. Very complex. Are we going to use aromatase inhibitors that we use for real breast cancer and selective estrogen receptor modulators like tamoxifen for breast cancer? Are we going to use them for women she's on testosterone with or without estrogen and progestins? We're going to use some AIs. I don't want to see this nuttiness, because this is going to be nuttiness. And some of it's happening in some of these clinics already. That's complete nuttiness. That's why if you anchor into real internal medicine and real gynecology and obstetrics, real doctors, and we all come together, it's going to be, I'm talking the few now into 20 years, it's going to happen. Because this stuff we have nothing else. We have Velisi, it's PT-141 they gave to women, they can inject it can help, it's helpful. The side effects I think are horrible, and it's not working, it doesn't make them horny. Okay, this is so complex. Again, but if you're going to use these medicines, use them. Stay away from this stuff unless you need it. And I agree with that. Anyone's going to agree with that. So, moving on. Weight changes, the skin, you're going to get puffy, the androgen, your brain, the CNS, the hair, is it all worth it? The clitoris, the breast changes. And in the end of the day, one thing that I do 24/7 for men on androgens, from a little androgen all the way up to the top pros in the world that are on tons of androgens and other drugs, ABCDs. Let's run them real quick, ladies, for you. So A1C is really not relevant to this, right? That's part of the coronary artery disease risk factors with diabetes and obesity in the country. But when you're on androgen, there's no question it's going to build muscle and burn fat potentially, depending on your diet. So A1C, that's not going to worsen that. B, blood pressure. Androgens, not to mention these other hormones you may be taking with it, your blood pressure is going to go up. There's a risk independent for stroke and heart attack. Let's keep going. C is cholesterol, cardiac disease. If you've had any of these things, you have to be it doesn't mean you can't do it, you can't take it. It just means that you have to know your ABCDs. You have to be super careful. This is all I do. I'm thinking, I'm going to make an anabolicdocapp.com pink. Anabolic app pink for you ladies. I'm going to do it. Thank you so much. So ABC, cholesterol, cardiac, get a calcium score. Ladies, get the calcium score. If you're young and 20 or something, it's a waste. But if you're in your 30s, 40s, you can check it. But if you're postmenopausal, ladies, you have to get a calcium score. Not to mention your family history. And the ABCs, what I'm doing here. A1C, blood pressure, cholesterol. D, this is very complex. Not to mention, if you have a family history of this stuff, so venous thromboembolism, big word. What does it mean? Blood clots in the legs go up, pulmonary embolism. You've heard of this. Androgens, estrogens, they monkey with this. They monkey with the heart, the liver, the kidney. But this is my stuff here. And then the D is deposition disease. Now, I thought with men with hereditary hemochromatosis genes, the Northern European guy that's on androgen, this is my day job, dealing with not just polycythemia potential, but high ferritin levels and iron. You have to check CBC and iron studies. And these places they're just making everyone dump blood if it's a man. I wonder what's going to happen with the women. Everyone's just going to start dumping blood. I know that the red blood cells go up for women. I've seen it because I've taken care of the professional women that are using pads. It's unreal. But then it's underlying what's your family history, what's your genetics, sleep apnea, your diet, all these things come together to lead to that D, which is potentially deadly for blood clots and pulmonary embolism. What else did I miss, guys? I think that's about it. I wanted to do a great job for you ladies out there. It's really my first video on the Anabolic Talk YouTube for you women out there. Just something that I haven't felt comfortable with really up until now. But you can see I have a lot of experience with it. Just kind of stayed away from it. So let's get the comments now. Ladies out there, please comment. Guys, you got a wife or a girlfriend, maybe a daughter or a mom, a woman in your life, or you're a young lady, or you're just any woman, you're just out there in your world, you're alone, and you are considering this, you've been on it. Please give comments, because that's the global goodness of this channel, that the videos started off. I lay it out for you guys. I lay it out from the clinical data. honestly as best I can with the evidence where we are today, modern, from a perspective of real goodness and not selling anything here, except for my app, of course, but just trying to get men on there, in the world. But I want people to comment, because that's really what brings this channel to the people. You read the comments and you start, wow, listen to this, listen to that. And that's the karma, that's the goodness. So thank you all very, very much. Let's maybe do some more things for women on this channel. Give me some comments on that. Thank you very much. And on May 26th, at the Upgraded Human Mastermind event, Plano, Texas, I'll be speaking on modern androgen therapy, the history of modern androgens, the spectrum of utility from testosterone all the way through to PEDs, understanding the necessary harm reduction, the androgen markets and future trends, of course, clinical application for both men and women, understanding risks, side effects, and of course, the future of androgens. I've been caring for men on androgens as an internist for over 20 years now. Please buy tickets and come out and see me and all the other great speakers at www.upgradedhumanmastermind.live. Thank you. I'll see you there.